Homeopathic Medication Part 13. Purported Effects in Other Biological Systems. While some articles have suggested that homeopathic solutions of high dilution can have statistically significant effects on organic processes, including the growth of grain and enzyme reactions, such as evidence is disputed since attempts to replicate them have failed. In 2001 and 2004, Madeline Ennis published a number of studies that reported that homeopathic dilutions of histamine exerted an effect of activity and of basophils. In response to the first of these studies, Horizon aired a program in which British scientists attempted to replicate Ennis' results. They were unable to do so. A 2007 systematic review of the high dilution experiments found that none of the experiments with positive results could be reproduced by all investigators. In 1988, French immunologist Jacques Benveniste published a paper in the journal Nature while working at INSERM. The paper purported to have discovered that the basophils released histamine when exposed to homeopathic dilution of anti-immunoglobulin E antibody. Skeptical of the finding, Nature assembled an independent investigative team to determine the accuracy of research. After investigation, the team found that the experiments were statistically ill controlled. Interpretation has been clouded by exclusion of measurements in conflicts with the claim, and concluded we believe the experimental data have been uncritically assessed and their imperfections are inadequately reported. Ethics and safety. The provision of homeopathic preparation has been described as unethical. Michael Baum, professor of emeritus surgery and visiting professor of medical humanities at University College London, has described homeopathy as a cruel deception. Edzard Ernest, the first professor of complementary medicine in the United Kingdom and former homeopathic practitioner, has expressed his concerns about the pharmacists who violate their ethical code by failing to provide customers with necessary and relevant information about the true nature of homeopathic products. They advertise and sell about the products that they advertise and sell. In 2013, the UK Advertising Standards Authority concluded that the Society of Homeopaths were targeting vulnerable ill people and discouraging the use of essential medical treatment while making misleading claims for the efficacy of homeopathy products. In 2015, the Federal Court of Australia imposed penalties on the homeopathic company for making false and misleading statements about efficacy of the whooping cough vaccine and recommending homeopathic remedies as an alternative. A 2000 review of the homeopaths reported that the homeopathic preparations are unlikely to provoke severe adverse reactions. In 2012, a systematic review evaluating evidence of homeopathy's possible adverse effects concluded that homeopathy has the potential to harm patients and consumers in both direct and indirect ways. A 2016 systematic review and the meta analysis found that in homeopathic clinical trials, adverse effects were reported among the patients who received homeopathy about as often as they were reported among patients who received placebo or conventional medicine. Some homeopathic preparations involved poisons such as belladonna, arsenic, and poison ivy. In rare cases, The original ingredients are present at detectable levels.